The relevance of medical interns and senior house officers in the provision of healthcare was put on a weighing scale during today's plenary in Parliament. It came from a report of the Health Committee on a petition by junior doctors on the one-year delay in deploying them for internship. Their necessity was underscored with a strong recommendation from the MPs for their prioritization by the government.
There's a huge problem, and I think I agree with my sister who says that right now government is merely paying lip service.
Issue of medical interns should be a priority. In most cases, when we go to the hospitals, the doctors, the special doctors work in shifts. And you find that when you go mostly at night, it is the medical interns that you find.
In the report, the Health Committee tasked the government to find 70 billion shillings that is needed for the deployment of the 1,900 interns who were allocated placements a year ago.
The committee recommends that the areas should be paid with immediate effect. Failure to provide funds for medical interns and senior house officers will worsen the already dire situation in the health sector.
Indicatively, the allocation for this was cut down in this financial year to 10 billion shillings from the 51 billion shillings allocated in the last financial year. MPs noted that the presidential directive for the increment of salaries for medical interns in 2021 at entry level is the cause of the crippling challenges of prompt payment.
Aware that it was not possible to pay the interns 2.5 million, the relevant ministers of finance and health should have immediately said this is not possible, so that they find a way of handling this matter. However, they sit down until there is a crisis.
The Deputy Speaker of Parliament, Thomas Tayebwa, questioned whether it was realistic for government to shoulder the responsibility.
Sustainability and reality help you make a very clear business decision. Is this issue sustainable? The day you start getting 5,000 doctors, will you be able to pay interns at this much? It's a question.
We need to facilitate them. We need to cease to see this as just some luxurious expenditure. It is not. These interns have got to feed. Many of them are being thrown out of the houses they are renting today.
Then came proposal for junior doctors to sit for pre-internship examinations.
We want to put quality controls in place to ensure that these doctors that we are churning out have understood the fundamentals of being doctors, nurses, and pharmacists. Right, Honorable Speaker.
After graduating for degree, then examination for license, examination for practice, simply to make life extremely difficult for these people. People who have graduated and degrees have been conferred upon them. Why do you subject them again to so many examinations?
For you to want to make it easy for him to graduate and lower the standards, okay, you are putting everyone at risk.
So is the Honorable Attorney General who wants quality control in order to continue in the same spirit that we are fighting against this house, to subject our children to all forms of torture when they are studying. Yet from A level they have qualified well for their further studies.
I concede.
Thank you. So now the motion carries the day.
The report also recommended that the Ministries of Health, Education and Finance quickly come up with an internship policy. It has also been recommended that the National Council of Higher Education should develop a database for medical students to provide a clear picture of the numbers to be planned for in the subsequent financial year budgets. Jackson Onyango, NTV at Parliament.
They should be using